The 6-minute walk test is used as an assessment of lung function and cardiopulmonary endurance. The test area should be prepared by marking off 30-meter segments of straight, unimpeded hallway. Interval markers should be placed every 3 meters, and the turn point should be marked clearly with visible objects such as a traffic cone. Be sure to have all materials handy, including but not limited to a stopwatch or timer, pen and paper for counting laps, pulse oximeter, blood pressure cuff, a Borg RPE scale, and any other equipment that would be necessary in the case of an emergency. Due to space restrictions, we used a 50-foot course. Be sure to document any changes. Prior to the test, the physical therapist should take the patient's vital signs and thoroughly explain and demonstrate the testing procedure to the patient using the script provided in the instructions. After taking vitals, the physical therapist says to the patient, "The object of this test is to walk as far as possible for 6 minutes. You will walk back and forth in this hallway. 6 minutes is a long time to walk, so you will be exerting yourself. You will probably get out of breath or become exhausted. You're permitted to slow down, stop, and rest as necessary. You may lean against the wall while resting, but resume walking as soon as you are able. You'll be walking back and forth around the cones. You should pivot briskly around the cones and continue back the other way without hesitation. Now I'm going to show you. Please watch the way I turn without hesitation." After demonstrating to the patient, the PT says, "Are you ready to do that? I'm going to use this counter to keep track of the number of laps you complete. I will click it each time you turn around at this starting line. Remember that the object is to walk as far as possible for 6 minutes, but do not run or jog. Start now or whenever you are ready." Throughout the test, the physical therapist delivers standardized encouragement at each minute. It is important to remember not to use any other encouraging phrases or body language throughout the duration of the test. Make sure to stick to the script. The physical therapist may walk with the patient throughout. However, in order to prevent influencing the patient's walking speed, it is important to stay behind the patient and outside of their line of vision. After the first minute, the physical therapist says, "You are doing well, you have 5 minutes to go." The physical therapist continues to provide standardized encouragement to the patient at each minute. If the patient needs to take a rest break during the test, they may stop as needed. They may stand or lean against the wall if necessary, however they may not sit down. If a patient needs to stop testing for any reason, be sure to record the reason for stopping as well as the duration of the test performed. When the timer shows 4 minutes remaining, the physical therapist says, "Keep up the good work, you have 4 minutes to go." When the timer shows 3 minutes remaining, the PT says, "You are doing well, you are halfway done." When the timer shows 2 minutes remaining, the physical therapist says, "Keep up the good work, you only have 2 minutes left." When the timer shows 1 minute remaining, the PT says, "You are doing well, you only have 1 minute to go." With 15 seconds remaining in the test, the physical therapist states, "In a moment, I'm going to tell you to stop. When I do, just stop right where you are and I will come to you." Stop. After the test is concluded, the physical therapist records the patient's vital signs and calculates the distance walked by the patient.